Is the heart cry of the book you published in 2004, Dr. Jean. Where have all the mothers gone? Stories of courage and hope during childbirth among the world's poorest women. Let's look at some of the faces and just a few visual highlights from the work that is going on. Now that looks like a healthy mom and baby.
Absolutely, and the mothers there carry their babies on their back like that. I'm always too nervous myself to ever carry my babies like that, but it's amazing. You'll see them often with baby on their back, something on their head, something in their arms. They work very, very hard. There's a young 14-year-old girl with her baby, and again, as Dr. Reeves said, I mean, here this girl's life has been changed now that she's had a child, but is she able to actually look after that baby? And thankfully she delivered in a health facility where she was safe. These are some of our Save the Mothers graduates.
Now just take note, third from the left on your screen. I know that person.
Yes, in my royal robe there. But again, these are some of our Save the Mothers graduates, people who are out in the communities, lawyers, journalists, social scientists, politicians, people who are out being advocates for safe motherhood.
These are professional champions.
They are, yes, exactly, yeah. And this group here, what a wonderful photo. These women have been mobilized again by one of our graduates who's like the mayor in their town, and they are making arts and crafts and selling them. And what they do with the proceeds is to help to put together a little fund to help mothers get to the health facilities that they need. So that kind of creative work is so important. Here's one of our other graduates, Honorable Sylvia Sinabulia, who's been here in Canada before. In fact, was just recently in Ottawa talking to our parliamentarians about safe motherhood in the developing world. But she's brought new legislation for safe motherhood and is really making an impact at that very high level of government. And Moira, that's important. We need grassroots solutions, but we also need people at the top who understand the issues and are going to advocate and spend the government's money on the right thing. Here's a traditional birth attendant's little home. This is actually one of the better traditional birth attendant facilities. But
so this is where the women come to have their babies?
This is where the women come to have their babies. And if you could see the rest of the room, there's absolutely no equipment there to help the woman if she ends up starting to bleed to death. There's no medication available. She's quite a long ways away from the health facility. And again, these women, the traditional birth attendants, are very socially sensitive, and I think we can learn a lot from their model, but it's not the safest place for mothers to deliver, for sure. And here's the transportation. I mean, you can just imagine being on the back of a bicycle in labor. I've been in labor myself. It's not a fun thing, and so the challenges of women getting to the health facilities.
What can we do over here in this part of the world to help this great need in the developing world?
Well, I think the first thing we can do is find out about it. And, you know, I'm just so grateful that Crossroads takes this time to really focus on an issue that's a global issue that also touches us as either Christians or not Christians, whatever our background is, that, you know, it's something that we focus on. So learning more, you can go to our website, savethemothers.org, learn more about. There's other organizations, the UNFPA and other groups where you can learn more about what are the issues behind these stories. People can also participate by, you know, instead of buying your father a tie or your mother flowers at Mother's Day, to actually participate in honor, give in honor of people, you know.
You have a big walkathon in
May. We do,
yes, all
we do.
over North America.
Exactly, yeah, exactly. So those kind of really creative ideas, and I just say to people, you know, come up with your own idea. We had a young woman who went and shaved her head for Save the Mothers. Now, I don't highly recommend that, but at the end of it, she raised like nearly $5,000 because she was so passionate. She'd come over to see the program, and she just thought, you know, she wanted to study to be a midwife, and she's in the program right now. She said, I want to have a voice and bring awareness to the issue, because I think, Moira, till the last couple of years, nobody even knew about this issue. Like 10 years ago, when I first started my career in this area, no one had even heard of mothers dying in the developing world. So I think the very fact that we in the West are starting to become aware of the issue, and then, you know, some people are able to go, some people are able to give, some people are able to pray. You know, this is a spiritual issue too. You know, Satan just loves to oppress people. And when mothers are dying, families are splitting apart, you know, he's just clapping his hands, and I think, you know what, as a Christian church, we need to pray against that, and to pray for women to have their basic right to life. Why should a woman die because she's trying to bring life to the next generation? So there's lots that Canadians can do, and I think we have to have the long distance approach. I always say to people, if you're a sprint runner, this is the wrong business, because bringing social, cultural change to any society doesn't happen in a month. You've got to be willing over the next 5, 10, 15 years to participate and see the change that is necessary.
But you must be encouraged since 2002
Absolutely.
with what this trailblazing
Absolutely.
has accomplished.
Definitely.
Wonderful.
Definitely.
SaveTheMothers.org. I think we're going to be hearing about the Mother Friendly Hospital Initiative in days to come, another program of Save the Mothers. And where have all the mothers gone? If you're just hearing about this for the first time, you can get this book online.
SaveTheMothers.org. SaveTheMothers.org.
SaveTheMothers.org as well. Thank you so much for what you're doing. God keep you well and strong. And love to that journalist husband.
Thank you. I will, definitely.
As well.
Thank you.
Please stay with us. We'll be right back.